Thank you, sir. Good morning, everyone. Myself, Dr. Gaurav Chamle. I am a neurosurgeon from Hyderabad. I am presenting full endoscopic complete excision of migrated disc prolapse single enter experience 1 year study. So endoscopy has definitely a very high efficacy in the migrated disc prolapse in terms of small incision, less trauma, good vision, and less post-op pain. So to aim, what was the aim of the study? To know the efficacy of these two techniques that we are commonly practicing, interlaminar and transforaminal endoscopic discectomy in migrated disc. So inclusion criteria: prolapse, migrated disc, sequestrated disc, recurrent or residual disc prolapse, age population between 18 to 75 years. Then symptoms should correlate with the MRI. Unsuccessful conservative management for more than 6 weeks. Exclusion criteria was segmental instability, lateral recess, central canal stenosis, end plate fracture, foramen stenosis, infections, tumors. So we had 10 cases of migrated disc prolapse during the period Jan 2021 to August 2022, out of which 6 were down migrated, 4 were up migrated. 6 of total 10 patients had cauda equina syndrome, 4 complete and 2 incomplete. Thorough evaluation was done and we performed interlaminar in 6 patients and transforaminal approach in 4 patients. They also have a motor deficit and all of them had a single or polyradiculopathy. So data was collected and pre and post operative MRI images of all the patients were obtained. Clinical follow-ups were taken at the end of post-op 1 month and 2 months. Clinical outcome was assessed by VAS score, Oswestry Disability Index and McNabb criteria. Stat analysis was done by SPSS software. Results were presented in mean and standard deviation. And we have done the VAS and ODI score with paired t-test. So these are the statistics. Interlaminar approach, average age was 50 years and leveled involved was at L3-4 1 case, L4-5 3 patients and L5-S1 2 cases. Transforaminal, the mean age was 58 and each of L2-3, L3-4, L4-5 and L5-S1 had 1 patient. In terms of migration, up migrated disc was total 4, 1 far up and 3 near up according to Lee et al. Classification. Down migrated was 4 far down and 2 near down. And you can see here the L2, L3 level, up migrated was 1, L3, 4 up migrated was 1, down migrated was 1, L4, 5, 1 up migrated and 3 down migrated. So operative time and fluoroscopy time. Transforaminal had a big operative time. The operative time was 60 minutes and a fluoroscopy time of 9.4, which was significantly reduced in interlaminar. The interlaminar fluoroscopy time was 2.4 minutes and operative time was 52 minutes. And it is statistically significant that interlaminar has less both the values. So results, we were able to remove all the migrated fragments in all the patients. 4 of them had residual paresthesias in the limbs. 1 patient with L4-5 down migrated and 1 up migrated. 2 with L5-S1 down migrated had paresthesias. 3 of the 6 cauda equina operations improved completely in 3 to 4 weeks of post-op. Rest 3 had perianal numbness persistent. No deficit or no dural injury was noted in any of the cases. So we have outcome measurement done by these 3 criteria. Due to short of time, as you see, VAS for the back pain was pre-op 8 and in transforaminal as well as in interlaminar it was less in the post-op. Same with the leg pain. And Oswestry Disability Index also was significantly reduced in post-op and 1 month and 2 months of follow-up. The McNabb criteria was showing a success rate of 94 and 93% respectively for interlaminar and transforaminal. These are some cases we did. High migrated L4-5 disc, which was completely reaching up to the S1 and plate. You can see in the image that the fragments have removed completely. This is the post-op. Another patient, we have done transforaminal, down migrated patient. The next is L2, L3 up migrated. You can see the in CM image, our cannula is directing up and our dissector has gone up to the right up to the up migrated fragment. These are the pre and post images of fragment and removed. This is again L4-5 up migrated. So I'll skip this because of time. So we conclude both transforaminal and interlaminar can be used in the treatment of migrated disc prolapse. However, upper lumbar levels we prefer transforaminal approach. Interlaminar has advantage of shorter operation time and fluoroscopy time. Interlaminar is better in down migrated in lower lumbar levels, while transforaminal is better in high migrated, up migrated and upper lumbar levels. Thank you, sir.